Hi, I'm Dr. Tom LaGrelius. I'm a family practitioner and geriatrician in Southern California with AAPP, and I want to talk to you about obstructive sleep apnea. Are you tired during the day? Do you fall asleep while you're watching television and the film is boring? Do you fall asleep while you're reading a book, sitting in a chair in the afternoon? Do you fall asleep in movie theaters? Do you feel tired all the time? Does your spouse say you snore and make a lot of noise at night? Well, then you probably have obstructive sleep apnea. This is a very common disorder. Perhaps a quarter or a third of males and maybe 10% of women in our society have obstructive sleep apnea. It is directly related to overweight. The more overweight you are, the more likely you are to have sleep apnea. But you don't have to be overweight. You can be thin and have sleep apnea. It is related to the structure of your tongue and your throat. If the back of your throat is small and your tongue is large, it's very likely that you're going to have trouble with your airway at night. It's closely related to snoring, and a lot of people with sleep apnea snore very loudly. Sometimes they drive people right out of the house. People can't sleep with them in the same room because they snore so loudly. But you don't have to be a loud snorer to have sleep apnea either. Sleep apnea can cause an awful lot of terrible consequences. It's strongly associated with diabetes. 50% of diabetics have obstructive sleep apnea. So if you're a diabetic, you've got to be tested for sleep apnea. Sleep apnea is associated with heart attacks, greatly increased risk of heart attacks and strokes in the middle of the night when your airway is obstructed. Sleep apnea is associated with major depression, mood changes. It's associated with memory loss and dementia. It's associated with, as I said, diabetes is strongly associated with it. It's associated with injuries, automobile crashes. People fall asleep while they're driving their cars if they have sleep apnea. And sleep apnea is very easily treated. Many people only need to be taught to sleep on their side, not their back, when they're sleeping, because it's much more likely that your tongue is going to fall against the back of your palate and obstruct your airway when you're on your back than when you're on your side. It's possible to put devices in your mouth called a dental guard that will hold your lower jaw forward 2 or 3 millimeters and prevent the tongue from falling back on the back of your throat and obstructing your airway. A dentist can make a dental guard, and actually you can make one yourself with a device you can buy in the drugstore. They're not as effective as the ones the dentists make. There are devices called ProVent devices that you can put in your nose, which allow free flow of air in but restrict the flow out a little bit so that the pressure in your throat builds up a little bit and the airway is expanded. But the most effective treatment for sleep apnea is a device called a CPAP machine. CPAP stands for continuous positive airway pressure. And it's a little nose mask that goes over your nose and goes to a pump that pumps air down your throat and pushes the tongue out of the way and opens up the throat so that you don't obstruct your airway when you breathe. These devices are incredibly effective, easy to tolerate once you get used to them, and incredibly helpful in preventing the serious complications of sleep apnea that I have described. Thank you.